Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about lumbar disc, herniation, and aerobic exercise. And I want you to listen carefully, because when someone hears disc herniation, the first reaction is often fear. Should I move? Should I rest? Will walking make the disc worse? Can exercise push the disc out more? These are important questions. Start with this idea. Lumbar disc herniation is not just a mechanical problem, like a piece of rubber slipping out of place. It is also a biological and neurological problem. The disc can irritate a nerve root. The area can become inflamed. The nervous system can become more sensitive. Muscles around the spine can guard and tighten. Sleep can worsen. Confidence in movement can drop. So the goal is not simply put the disc back. The goal is to calm the system, protect nerve function, improve tolerance, and help the person return to normal life safely. Look at what happens inside the lower back. Between the bones of the spine, we have discs. A disc has a tougher outer ring and a softer center. In a herniation, some disc material can bulge or push outward and irritate nearby nerves. If the nerve going down the leg is affected, pain may travel into the buttock, thigh, calf, or foot. Some people feel numbness, tingling, burning, or weakness. This is why one person may say, "My back hurts," while another says, "My leg is on fire." Now ask yourself, if a nerve is irritated, why would aerobic exercise help? Why not just lie down until everything settles? Because the body does not heal well through total shutdown. Complete rest can make the back stiffer, reduce muscle endurance, reduce blood flow, worsen mood, disturb sleep, and increase fear of movement. Many clinical guidelines for low back pain and sciatica recommend staying active when it is safe, and they include exercise as a core part of conservative management. Systematic reviews have found that exercise can improve pain and function in many people with low back pain, and studies focused on lumbar disc herniation suggest that exercise therapy can help symptoms and disability, although the exact best exercise plan is still not fully settled, so be precise. Aerobic exercise does not cure every disc herniation. It does not guarantee that the disc disappears. It is not a replacement for medical evaluation when there are warning signs. But it can be a powerful part of recovery because it changes the environment around the pain. What do we mean by aerobic exercise? Think walking, stationary cycling, water walking, swimming, gentle elliptical work, or other rhythmic activity that raises the heart rate without heavy straining. You should still be able to speak in short sentences. That is a useful guide. This is not maximal training. This is controlled movement that your nervous system can accept. Why does this help? First, aerobic exercise improves circulation. The disc itself has limited direct blood supply, especially in adults, but the tissues around the spine, the muscles, ligaments, joints, and nerve-related structures still depend on healthy movement and circulation. Gentle repeated movement can help bring nutrients into the area and clear inflammatory byproducts. Think of it less like forcing the spine and more like bathing the tissues in motion. Second, aerobic exercise activates pain-modulating systems in the brain and spinal cord. Pain is not imaginary, but pain is processed by the nervous system. When you move at a tolerable level, the brain receives a message. This movement is safe enough. Over time, this can reduce protective guarding. The body releases natural pain-modulating chemicals, and the spinal cord can become less reactive. How does that matter? If every step feels dangerous, the system amplifies the signal. If controlled walking is repeated and tolerated, the system can gradually turn down the alarm. Third, aerobic exercise reduces deconditioning. Look at patients who stop moving for several weeks. Their hips stiffen, their hamstrings tighten, their gluteal muscles switch off, their core endurance drops, their walking pattern changes. Then the back has to absorb more stress from a weaker, tighter system. Aerobic exercise keeps the whole body participating. It helps the legs, hips, lungs, heart, and spine work together again. Fourth, aerobic exercise can improve sleep and mood. Why does that matter for a disc herniation? Because pain and sleep talk to each other. Poor sleep lowers pain tolerance, anxiety increases muscle tension, low mood reduces activity, reduced activity worsens stiffness. This loop can keep symptoms alive even after the first injury is improving. A gentle daily walking plan can help break that loop. Fifth, aerobic exercise helps with body weight and metabolic health. This is not about blaming the patient. It is about reducing load and improving inflammatory balance. People with diabetes, obesity, or poor cardiovascular fitness may have slower recovery from musculoskeletal problems. Aerobic exercise supports the body globally, and the spine lives inside that body. Now let's make this practical. Do this step by step. Start with safety. If you have loss of bladder or bowel control, numbness around the groin or saddle area, new or worsening leg weakness, foot drop, fever, major trauma, cancer history with new back pain, unexplained weight loss, or severe pain that is not letting you function, get medical evaluation promptly. Do not try to walk through those symptoms. If you are pregnant, have heart disease, severe lung disease, uncontrolled blood pressure, diabetes with foot numbness, balance problems, or you take sedating medicines, ask a clinician how to begin safely. Next, choose the right aerobic exercise. For many people, flat walking is the best starting point. Why? It is simple, low cost, easy to adjust, and the spine usually tolerates it better than heavy lifting or twisting. But walking is not perfect for everyone. If walking sends sharp pain further down the leg, try a stationary bike with a comfortable upright posture or water walking in a pool. If cycling bends your spine and increases symptoms, choose walking instead. The exercise is not the hero. The correct dose is the hero. Use the symptom rule. During exercise, mild discomfort in the back may be acceptable, but pay attention to leg symptoms. If pain moves farther down the leg, if numbness increases, or if weakness appears, stop and reassess. If pain becomes much worse and stays worse into the next day, the dose was too high. If symptoms become more centered toward the back and less intense in the leg, that is often a better sign. Ask yourself after each session, where is the pain? How strong is it? How long did it last? Did I walk better afterward or worse? Start lower than your ego wants. If you have been in pain for weeks, do not begin with 45 minutes. Begin with 5 to 10 minutes on flat ground. Do it once or twice daily if tolerated. Keep your stride short. Keep your shoulders relaxed. Let the arms swing gently. Avoid hills at first. Avoid speed walking at first. Do not hold your breath. If 10 minutes is too much, do 3 minutes. Then rest. Then do another 3 minutes later. The nervous system likes consistency more than drama. Progress slowly. Add a few minutes every several days if symptoms remain stable. A reasonable goal for many people is 20 to 30 minutes of moderate aerobic activity most days, but that may take time. Some people need weeks, some need longer. Do not compare your recovery to someone online. Look at your own pattern. Now, what about running? Be careful. Running creates more impact and may not be the first choice when leg pain is active. If you are pain-free or nearly pain-free, walking well, sleeping well, and have no neurological symptoms, a clinician or physical therapist may guide a gradual return. But do not jump from painful sitting and limping into jogging because you are frustrated. Frustration is not a treatment plan. What about swimming? Swimming can be helpful, especially if the water reduces load and allows comfortable movement. But some strokes increase spinal extension or rotation. If breaststroke or butterfly increases back or leg pain, stop. Try water walking or gentle backstroke if tolerated. Again, let symptoms guide the dose. What about cycling? Stationary cycling can be good for people who tolerate slight flexion, but if sitting triggers sciatica, cycling may flare symptoms. Adjust the seat. Keep resistance low. Start with short sessions. Pay attention. Here is the deeper point. Aerobic exercise works best when paired with education and smart movement habits. Do not spend the whole day sitting in a painful posture and then expect a 10-minute walk to fix everything. Change positions often. Use short walking breaks. Avoid repeated bending and twisting while symptoms are irritable. When picking something up, bring it close to the body. Use your hips and legs. When coughing or sneezing, brace gently and avoid bending forward if that triggers pain. Also, combine aerobic exercise with the right rehabilitation when appropriate. Many people benefit from physical therapy that includes directional preference exercises, core endurance, hip strengthening, nerve mobility techniques, and graded return to daily tasks. Aerobic exercise is the base layer. It builds capacity. Specific rehab builds control. Let's talk about medication for a moment. Some people take anti-inflammatory medicines, muscle relaxants, nerve pain medicines, or opioids. These may have a role in selected cases, but they can also cause side effects. If a medicine makes you dizzy or sleepy, do not go walking outdoors alone on uneven ground. If you are taking blood thinners, have kidney disease, stomach ulcers, high blood pressure, or heart disease, ask before using anti-inflammatory medicines. Exercise and medication decisions should fit the person, not just the MRI image. Now, about MRI findings. This is important. Many people panic when they read words like protrusion, extrusion, or nerve root contact. But images do not always match pain perfectly. Some people have disc findings and little pain. Others have severe symptoms with smaller looking findings. Treat the patient, not just the scan. Ask, can you walk? Are symptoms improving? Is strength stable? Are daily activities returning? These questions matter. How long does recovery take? Many people with sciatica from disc herniation improve over weeks to months with conservative care. Some improve faster. Some need injections. Some need surgery, especially when pain remains disabling despite treatment or when neurological deficits progress. Aerobic exercise is not a promise that surgery will never be needed. It is a way to support recovery and preserve function while the body and the medical team decide the path. Use this simple plan. Day 1, choose one tolerable aerobic activity. Day 2, record your baseline, time, pain location, pain intensity, and how you feel the next morning. Day 3 onward, repeat the dose that your body accepts. Do not chase pain. Build trust. If symptoms are stable for several sessions, increase slightly. If symptoms flare, reduce the dose, change the activity, or speak with a professional. Pay attention to the language you use with yourself. Do not say, my back is broken. Say, my nerve is irritated and I am training my system to tolerate safe movement again. That is not just positive thinking, it changes behavior. Behavior changes recovery. So, can aerobic exercise benefit lumbar disc herniation? Yes, for many people, when it is chosen carefully, dosed properly, and combined with good clinical judgment. It can reduce sensitivity, improve function, maintain conditioning, support sleep, and help people return to normal life. But it must be respectful of symptoms. It must not ignore red flags. It must not become punishment. Start small. Walk flat. Breathe normally. Track your response. Progress gradually. Ask for help when symptoms are severe, persistent, or changing. And remember, the goal is not to prove toughness. The goal is to restore safe, confident movement. Take good care of your spine, take good care of your whole body, and keep learning with us. I'll see you in the next topic.